All right, good morning and welcome to your last lecture for 2020 in CHN, Community Health Nursing NCM 104. All right, so for your last topic, so I'll be discussing about records in family health nursing practice. Okay, so this is your 11th week and this is from the website currentnursing.com. Okay, so nursing management documentation. So we're going to talk about reports. Okay, so how important records are or reporting in the when we have to deal with family health nursing practice. All right. So as we all know, records, these are, of course, effective health records, which show the extent of the health problems, the needs of our clientele, the family, okay, and of course, other factors that affect individuals, and how this thing will provide them the ability to provide care and what the family believes in, okay, and how are they going to deal with the problem, okay. So of course, the records will also reflect, okay, what has been done, okay, and what had to be done, okay. So it can also indicate plans for future visits in order to help the family to meet the needs, okay, or their present problems. Okay, so what are the importance and uses of records? Okay, so of course, it will provide us documentation of services that have been rendered, okay, what you have done before. And of course, the records will supply us the data, okay, so that we can possibly and of course plan the program for this family. Okay, so this will also provide the practitioner the data required for application of professional services. Okay, so that we can improve more the health of the family. And of course, this serves as a tool for communication because you will be able to communicate. Okay, you can be able to relate or relay the information to the those who are in touch with the family. Okay, those who are indulged or those who are assigned. Okay, to take care of the family. Okay, so of course the health records will show the health problems in the family and of course other factors that has something to do with their problems. Okay, so that will also indicate a plan for the future because we are going to plan using these records. Okay, so we can plan what we're going to do next. Okay, and eventually come up with another program for them. Okay, so of course, records will always provide us baseline data so that we can estimate, okay, long-term changes, okay, and that will always be related to the services that we provide, okay. So this will also provide us information or opportunities, okay, for providing evaluation of the situation because in the records you will see everything, okay, what has been done, okay, and what has to be done. Okay, so first we are looking into also on the principles of how do we record or how do we write. Okay, so of course, as nurses, we have to develop our method of expression and format in recording or in writing. Okay, so when you are writing, it should always be written clearly, appropriately, and legibly. So those words or those handwriting that can be read. Okay, can be read easily. Okay, so the record should always contain facts, okay, based on your observation, conversation, and action, not a personal note, okay. That should always be a factual information that we have to write, okay. So we have to also select relevant facts, and the recording should be neat, okay, complete, and uniform, okay. So you should always remember that. So you should write legibly, okay, and one that is really readable. Okay, so first, records are valuable legal documents. So we always have to consider this as legal documents because uh, erasures are not allowed here. Okay, or if there will be, you cannot get rid of erasures. So making sure that you have the policy on how to erase things. Okay, that has been written. Okay, that's why we have to handle these records carefully, and we are really accountable for all that we write in here. Okay. So of course, the record systems are essential for efficiency and uniformity of services because record or record keeping, okay, record the section of any agency, healthcare agency will always be uniform. Okay, meaning to say they follow the same rulings, the same ways of processing or writing or recording things or documents. Okay, so of course, records will should provide for periodic summary so that we can determine the progress and to make future plans, as I have said earlier. Okay, so of course, record should be written immediately after an interview so that you cannot forget it. Okay, because it will be hard if you're going to do your interview now uh, and then after the interview you're going to do something. Okay, so it's better after immediately after the interview you have to do the writing or the recording. Okay, and you should always remember records are confidential documents. Only those who are in touch or those who are taking care of the patient, they have the right, okay, to see the documents. Others that who do not have the business on taking care of our patients, so they are not allowed to see what's inside the documents or the records of our client. Okay, of course, we value, okay, the importance and uses of records. So because records provide us facts for services, okay, so it shows health condition as it is, and the patient, and of course, family accept it because they are the one who provided the information. We are just the one who transcribe all the information that you get, okay? So of course, records will provide us analysis, okay, or analysis or how this will be the basis for analyzing needs. Okay, so in terms of what will be done, okay, what has been done, what is being done, okay, what is to be done, and of course the goals, okay, towards which means are to be directed. Okay, where are we heading to with regards to the care that we are providing to our patient. Okay, so of course, as I have mentioned, basis for short and long-term planning. Okay, so how long are you going to provide the services to the patient? So the records will provide us, okay, so that we can plan, okay, we can easily, okay, draft plans for the services that we are going to give, okay. So also records, it prevents duplication of services, okay, and helps follow up services effectively because what has been done before by the nurse, okay, by your co-workers should not be, repeated, okay, so you are not duplicating the services that you are giving. Okay. So, of course, it also helps the nurse to evaluate the care and the teaching which she has given because we also try to write, okay, or document what topics, okay, or what educative topics we have provided to our patients. Of course, it has something to do with how to maintain health, okay, how to promote health, and of course, how to prevent diseases. Okay, so it also helps the nurse to organize her work in an orderly manner, okay, so that we can make an effective use of time, okay, because we are also talking about time. So when we go to the community and take care of the community and the families there, so we always have the timeline, okay, the timetable, and how are we going to provide, or when, okay, until when are we going to provide the services. Okay, of course, this also serves as a guide to professional growth, okay? Because as long as you are continuing with what you are doing, so you are also learning. You are trying to uplift yourself. You are trying to provide experiences for yourself, for your professional. And of course, we can also consider personal growth on that matter, okay? So we can also judge the quality and quantity of work that have been done, okay? Since we have the record, and then we can follow up, okay, we can add more, or we can, skip on things that we do not need to do since you have the record already, okay. So we become aware, okay, and we recognize their health needs as much as we can, or as the record provide us, okay, because records also serve or use as a teaching tool, because if you see the records and then you have record, or the last nurse, okay, was not able to record, or she was able to record, he or she was able to record, okay, that this has to be followed up, okay, these things has to be provided, the information, more information on a certain topic, on a certain issue, Okay, so then you can give it right away. Okay, so you can teach. Okay, you can provide the education to your patients. Okay, so of course the records serve as a guide for diagnosis, treatment, and evaluation of services. Okay. Okay, of course it indicates progress, okay, because you can see from the records if the patient has already, achieved something, okay, achieved based from your plans, based on your objectives, uh, if they have reached, okay, the goals that you have set to them, okay. So of course the records will always show us, okay, data, okay, or information that can be used in research, okay. So you can derive topics, okay, researchable works, okay, based from the information that you get uh, from the records, okay. So the records helps identify families needing services and those prepared to accept help. Okay? Yeah. Okay, it all enables him to draw the nurse's attention towards any pertinent observation he has made. Okay? The records help the supervisor evaluate the services rendered, teaching done in a person's actions and reaction. Because also your supervisor will check on it. Okay? So guiding of staff and nurses, okay, when already you have the plan, okay, so you can utilize this as an evaluation tool during conferences because this will provide you a lot of information. So the records will provide you more information, additional information. Okay. Of course, on the from the perspectives of administrators, so they can assess the health assets and needs of the village or area because you're going to tell them also the administrators of the certain community, okay, what has been found, okay, what has been the results of what you have done, okay. So again, since it is these records are for legislative action or legal documents, so we can also provide this for legislative action and for planning budget. Lalong-lalo na if we are talking about the barangay, okay, community, and then they provide the budget for a certain program. Okay, legal evidences of services rendered by each worker. Okay, and of course, since we are talking about budget, records will always provide us justification for expenditure of funds because nurses also have to write down, you have to record what has been, what has been, spent, okay? So, ano na ba yung mga naano nila, nagastos nila, okay, during the entirety of the program, okay? Okay, so in what are the types of records that we are talking about? So we have cumulative or continuing records. Okay, so they say that this is found to be time saving, okay, economical, and it is also helpful to review the total history of an individual. Okay, and we can also evaluate the progress for a longer period. So example natin, child's record should provide space for newborn, infant, and preschool data because we know they grow, they develop, okay, into from being a newborn, okay, so syempre you have to make it sure that you know the development of the baby or the child, okay? So that's an example of cumulative or continuing records, okay? So example natin, yung kanilang immunization, yung age nila, weight, okay, height, okay? So the system of using one record for home and clinic services in which home visits are recorded in blue and clinic visit in red ink helps coordinate the services and saves the time. Okay, so sometimes they provide a way of determining, okay, so what are the different services? Okay, pwedeng home, pwedeng clinic. Okay, so they uses different ink, okay, or they uses different colors of the card. Okay, so yun yung record na inaano natin. Sometimes they have to provide an identification card so that whenever they uh, they avail the services, so when they go to the clinic or to the how do you call this, barangay health center, so you will easily, okay, you will see easily tell, okay, saan ba yung kanilang records, saan galing, okay, because of the color of the. And then of course we have, okay, so the next type, family records. Okay, so because our services in the community is basically the for the family. Okay, so the basic unit of service is the family. So all the records relate to the members of the family, and we should always keep those records in a single family folder. Okay, because this will give us a better picture of the total services that helps to give us, okay, for us to be effective, okay, and economic services to the family as a whole. Okay, so of course, based also from the different types of services that we give to a
The next
family or to
type,
the family, so we can also separate the records.
family
Okay, so for
records.
example, natin based on the case,
Okay,
like
so
for
because our
maternity, for
services in the community is
tuberculosis, if one of the
basically
family
the
members has
for the
TB,
family. Okay, so the basic
immunization,
unit of
okay, so
service, the
individual
family.
records naman.
We
So
are relating
all the
now to the
records
members
relate
of
to the
the
members of the
family.
family, and
Okay, so and we can also
always keep those
save that
records
or
in a single
put
family
that in a
folder.
single
Okay,
family
because this
folder.
will give us
Okay,
a better picture of the total services
and
that
then, of course, how do we
helps to
file
give
records? Okay,
us, okay, for us to be
so it
effective,
is
okay,
usually
and
based on the
economic
policy of the
services to the family as a
facility
whole.
or the
Okay, so of
organization.
course,
Okay, so for example,
based also from the
we can
different
arrange
types of
the
services
records
that we give to a
alphabetically. Okay,
family
so
or to the
we can
family, so
use the
we can also
surnames of the
separate the
family.
records.
Okay,
Okay,
so
so for example, natin based on the
alphabetical
case,
order.
like
Okay,
for
we can also
maternity, for
file the
tuberculosis, if
records
one of the family
numerically,
members
meaning to
has
say we can
TB,
assign numbers. Okay, for
immunization,
example,
okay,
natin
so
to family
individual
case
records naman,
numbers,
we are
case
relating now to the
number, okay,
members of
or
the
we can use the
family.
one
Okay,
to
so and we can
the
also
um
save that
what do
or
you call this
put that in a single
1 2 3 4
family
5
folder.
6 7
Okay,
8 9 and so on and so on. Okay, and of course we
and
can
then of
also
course, how do
do
we
a
file
geographic
records? Okay,
filing of
so
records. So
it
based
is
from for
usually
example
based
natin
on the
sitio
policy of
per
the
sitio per barangay, okay,
facility or
or
the
street per
organization. Okay,
street
so for
per
example,
ward, okay, or
we can
whatever.
arrange the
How do
records
you call the
alphabetically.
different
Okay, so we can
geographic
use the
settings of
surnames
the
of the
community.
family.
Okay, and then
Okay,
of course we can
so
also use index card.
alphabetical
Okay,
order.
so with the
Okay,
index
we
card
can
you can label it,
also
you can tag it. Okay,
file
how
the
do you like
records
to
numerically, meaning to say
how do
we
you
can
like to
assign
file the
numbers. Okay, for
records?
example, natin
Okay,
family case
yeah.
numbers,
Okay, and then we can
case
have
number.
registers.
Okay,
Okay,
so
or
that will
we can
provide
use the
us.
one
Okay, so
to
it's a
the
bigger, larger area of
what do you call this?
recording. Okay, so we can
One, two, three,
the
four,
total
five, six, seven,
volume
eight,
of
nine, and
services
so
and
on and
then the
so
type
on.
of
Okay,
cases that
and
can
of
be
course we
seen.
can
Okay,
also
so
do
of
a
course we need
geographic
clerical assistance with
filing of
this. Okay,
records.
so
So based
someone will
from,
be
for example,
assigned.
natin
Okay, as
sitio per
for
sitio per
example natin
barangay,
pwedeng
okay, or
secretary, okay, or
street
clerical
per street
assistance
per
na nga tawag sa
ward, okay,
kanila.
or
Okay,
whatever.
so
How
mas
do you
ano
call
yun,
the
mas
different
detalyado. They know
geographic
different
settings
parts
of
of
the
the
community.
register
Okay,
or
and
the
then of
record,
course we can
okay,
also use
section of
index
the
card.
area.
Okay,
Okay,
so with the
or of the
index card you can
facility.
label it, you can tag it.
Okay,
Okay, kung
so
how do you
we can
like to
compile
how
our
do you like to
reports
file
daily,
the
pwede rin namang
records? Okay,
weekly, monthly,
yeah.
quarterly, and
Okay, and then we can
annually. But
have
of course, we do it
registers.
on a
Okay,
daily
so
basis.
that
So
will
as
provide
nurses,
us.
we
Okay,
try
so
to
it's a
keep the record
bigger,
at
larger
once. Okay,
area
so
of
kanga kanina,
recording.
after the
Okay,
interview, so
so
you
we
can
can
do
do
the
the
total
recording after the
volume of
interview so that you
services
will
and
not
then the type
be
of cases that can
forgetting.
be
Okay,
seen.
some of
Okay,
the
so
information
of
that
course we
was
need clerical
that
assistance with
were
this. Okay, so someone
provided
will
by
be
the
assigned.
client.
Okay,
Okay, client.
as
Okay,
the for example
so
natin pwedeng
our report will
secretary,
always
okay, or
summarize the
clerical assistance na
services,
nga ang
okay,
tawag
that
sa
we have
kanila. Okay,
provided. Okay,
so mas ano
so we
yun,
can also
mas
report in the
detalyado. They
form
know
of
different
analysis,
parts
okay,
of
of
the
some aspect of
register
the
or the
service. So
record,
it's like a
okay, section
qualitative
of the
one,
area
okay, wherein you can
or of the
narrate, okay, what
facility.
happened, okay,
Okay,
and
so
of course a
we can
record should always be
compile
based and
our
registered so that
reports daily,
it will
pwede rin
maintain the
namang weekly,
records, okay, it
monthly,
will maintain the
quarterly, and
information,
annually.
okay,
But of course,
regarding
we
the
do it on
daily
a daily
caseload,
basis. So
okay, the
as
services,
nurses,
loads,
we try
and
to
of
keep
course
the
the
activities
activities
that we have
ones, okay,
done.
so
Okay, kanga kanina,
so that you
after the
can
interview, so you can
do the
the recording after the
data
interview so that you will
recording,
not
okay,
be
continuously and for a
forgetting,
longer
okay, some of
period
the
of time.
information that
Okay,
was
so you can keep that
okay, the
were
data after
provided by
period of
the
time.
client.
Okay,
So what are the
clients. Okay,
purposes of writing
so our
reports? Okay,
report
now
will always summarize the
as you can see in
services,
the
okay,
picture,
that we
we
have
will also have
provided.
now the
Okay,
e-health
so we can
records.
also
Okay,
report
so
in the
using
form
tablets,
of
okay, of course the
analysis, okay,
gadgets in
of
the
some
hospital side.
aspect of the
Okay,
service. So
so
it's
but of
like a
course in the
qualitative
community,
one, okay,
usually
wherein you can
computers,
narrate,
okay, and
okay, what
even
happened,
written
okay,
reports pa rin ang
and
ipiniput
of
doon.
course a
Okay,
record should
so
always
of
be
course
based and
the
registered so
writing
that
reports will
it
show
will
us the
maintain
kind
the
and quantity
records.
of
Okay, it
service
will maintain
rendered
the
over a
information, okay,
specific
regarding
period of
the
time.
daily
Okay,
caseload, okay, the
so
of
services
course,
loads, and of
if we
course the
have reached
activities
our
that we have
goals,
done.
okay,
Okay,
we
so
can
that we
see it
can
from the reports, okay, the
do
progress,
the
okay, so
data
that can always be an
recording,
aid in
okay,
studying the
continuously
health
and for a
conditions
longer
of the
period of time,
family or
okay,
of the
so
entire
you can keep,
community, okay,
okay,
so
the
that will
data
also serve
from that
as an
period of
aid
time.
in
Okay.
planning. And of
So
course,
what are the
we
purposes
can
of writing
interpret the
reports
services that
okay,
we
now
have provided, okay,
as you can
so
see in
and
the
of picture
picture
we
with
will
other
also have now
interested
the
agencies, we
e-health
can provide
records,
them
okay,
with
so using
information based
tablets,
from the
okay, of course the
records, okay,
gadgets
so
in
for
the
example
hospital,
natin may mga
okay, so
NGOs
but of course
or
in the
other group of people
community,
that would like
usually
to
computers, okay, and
provide
even ano
written reports pa rin ang
services,
ginigit
okay,
namin.
based
Okay?
from the
So of
records that you
course
have
the
provided them. So
writing
they will be
reports will
asking.
show us the kind and
Okay?
quantity of service rendered over
So,
a
of
specific
course,
period
it's
of time.
statistical
Okay?
reports, okay?
So
So you
of
should have
course,
always a
if we
narrative
have reached
report
our
monthly,
goals, okay,
okay? So that
we
we
can
can see it
from the
present
reports,
it to
okay, the
administrative,
progress, okay,
so that can always be
conferences,
an
okay,
aid in
because sometimes you
studying
will
the
be
health
called,
conditions
okay,
of the
so kung
family
ikaw
or
ay
of the
working
entire
in the
community.
barangay and then
So
you will
that will
be,
also
there
serve
will
as
be
an aid in planning. And of
a
course,
all barangay
we can interpret the
report
services that
or
we have provided,
conferences,
okay?
so you can
So, and of
provide,
course,
easily
with
provide a
other interested
statistical
agencies,
report,
we can
okay?
provide them
So for
with
example natin,
information based from the records, okay?
cases ng
So,
mga
for example
dengue,
natin, may
cases
mga
ng
NGOs,
COVID,
okay,
or
so you
other
can
group of
provide
people
kasi
that
you
would
have
like
the record,
to
okay? So, it
provide
may be,
services,
it
okay,
is time
based from the
consuming, but they
records
are
that we have
definitely
provided them. So
important,
they will
okay,
be asking,
in our
okay?
community health practice, okay, so that we can
So, of course,
solve
it's
health
statistical
problems, okay,
reports,
better,
okay? So you
okay?
should have
So,
always
because
a narrative
all this
report
records, so as I
monthly,
have
okay? So that you can
previously
present it to
told you, okay,
administrative
so it's important, okay? So
conferences,
that we
okay?
keep
Because
all the
sometimes you will be
records,
called,
okay,
okay?
accurately,
So kung
okay?
ikaw ay
So, of
working in
course,
the
records and
barangay and then
reports
you will be,
revels the
there will be
essential aspects of services in
all
such
barangay
logical order. Okay,
report
so that
or
the new staff, okay,
conferences,
or the
so you
next,
can provide, easily provide
next
them a statistical
generation,
report,
or
okay? So for example natin,
next nurses who will be working there
cases
will
ng
be
mga
able to
dengue,
maintain
cases ng
continuity of
COVID,
services.
or
Okay, so you
if
can
if it
provide kasi
happens
you
that you
have
are
the
going
record.
to
Okay, so
retire,
it
okay, so you
may
will have
be
that proper endorsement,
it is
okay?
time consuming, but they are definitely
For the
important. Okay,
continuity of care
in
to
our community
individuals,
health
families, and
practice.
the
Okay, so that we
community
can
as a
solve
whole.
health
All right,
problems. Okay,
that's
better.
it.
Okay,
Okay,
so
so
because
if you have
all
any
these records,
question,
so as
okay,
I
so you
have
can just
previously
you can
told
message
you, okay,
me,
so it's
okay, via
important, okay,
messenger, okay,
so that
about
we
what
keep
I
all
have
the records,
discussed,
okay,
okay, so for the
accurately,
meantime,
okay. So of
since this is
course,
your
records
last
and
topic
reports
for
revels the essential
2020, okay,
aspects of
so
services in such
thank you so
logical
much
order. Okay, so
BSN2C,
that the
and
new
thank
staff,
you,
okay, or
okay,
the
thank you
next,
2020 still,
next
okay, we have to be
generation, or
thankful. Ang dami nating natutunan sa
next
2020, though
nurses who
this
will
is
be
a very
working there will be
challenging
able to
year
maintain
for all
continuity
of
of
us,
services, okay,
or
but still
if
we
you if
are
it happens that you
we
are
are
going to
safe, okay, just
retire,
be
okay,
safe
so you
all
will
the
have that
time,
proper
okay, so
endorsement, okay,
maging masaya pa
for the
rin, okay,
continuity of
and
care
of
to
course, Merry Christmas
individuals, families, and the
everyone, okay,
community as
yeah.
a whole. All
And
right,
happy and
that's
healthy
it. Okay,
2020.
so if you have any
Thank you.
question, okay, so
Okay, so
you can just comment,
you can
okay,
message
dyan
me,
sa
okay,
mga comment
via
boxes dyan
messenger,
sa
okay,
baba, okay,
about
so
what
that
I
I
have
can check also if
discussed.
you have
Okay, so for the meantime,
watch or
since this is your
watch
last
the
topic for
my
2020,
lecture,
okay,
last lecture
so
this 2021.
thank you so
Thank you so
much,
much,
BSN2C, and
bye-bye.
thank you, okay, thank you 2020 still,
Enjoy
okay,
the
we have to be
holidays. See
thankful.
you
Ang dami nating
in
natutunan sa
January
2020, though this is a
2021.
very challenging year for all of us, okay, but still we are safe, okay, just be safe all the time, okay, so uh, maging masaya pa rin, okay, and of course, Merry Christmas everyone, okay, yeah. And happy and healthy 2021. Thank you. Okay, so you can just comment, okay, dyan sa mga comment boxes dyan sa baba, okay, so that I can check also if you have watch the my lecture, last lecture this 2021. Thank you so much. Bye-bye. Enjoy the holidays. See you in January 2020.